Hi, this is Ms. Talat Abbas. Today we are going to discuss coronary heart disease. Before going to start coronary heart disease, we must be having few things in our mind. That what is vascular system of the body? Is coronary heart disease the only disease of the vascular system? The vascular system of the body is actually the system which provides all the nutrients to the body from one part to another via blood. Now, coronary heart disease, is it the only disease of the vascular system? If you see the normal coronary artery, the flow of blood in normal coronary artery will be like this. The lumen here is showing that it's very clear, there isn't any kind of deposition. Now the term you may come across, that is atherosclerosis. There is fatty deposits in the lining of the artery that it blocks the way of blood as cholesterol develops, so the flow of blood is disturbed. Here it represents atherosclerosis with blood clot. So again, my question is coronary heart disease the only disease of the vascular system? The answer is no. It's not only a single disease. However, there are a group of different illnesses that affect your heart and blood vessels. Coronary heart disease, or we can say that cardiovascular diseases, are the leading cause of death in different countries. However, we can say that cardiovascular diseases includes coronary heart disease, stroke, high blood pressure, heart failure, etc. So why are we studying, why we have focusing on coronary heart disease? Just have a look on it. Deaths from cardiovascular diseases, this graph is clearly depicting, this pie chart is clearly depicting that the ratio of death from coronary heart disease is 51%. That's why we are considering this topic into this lecture. Let's talk about coronary arteries for coronary circulation. Coronary circulation, you may see coronary arteries here and here. This is actually anatomy of heart, that is external structure of heart. Like all the body cells, they need oxygen for energy. In the same way, the heart muscles, they also need oxygen-rich blood for its survival. Blood is supplied to the artery by its own vascular system called coronary circulation. Here the aorta, which is the, you can say the main artery supplied blood to all parts of the body, it branches off into two main coronary arteries, the right coronary artery and the left coronary artery. It supplies oxygen-rich blood to the entire heart muscles. It's obvious that the right coronary artery here and the left coronary artery, it branches into two other subdivisions, that is circumflex artery and left anterior descending artery. Why is it so? The reason is the right coronary artery supplies blood to right side of the heart, which is smaller as compared to the left coronary artery, because it pumps the blood only to the lungs, while the left coronary artery branches into left anterior descending artery and circumflex artery. It supplies blood to left side of the heart, and this side is larger and more muscular because it pumps blood to rest of the body. Coronary heart disease. Now, coronary heart disease is actually the narrowing of the small blood vessel that supply blood and oxygen to the heart. Just see to this picture. Here this is healthy artery, and here you may see fatty deposits. The size of lumen, you may see there is a change. Now again the size of lumen becomes smaller. As fatty deposits, it obstructs blood flow. It becomes narrower and it's a complex blockage. Ultimately, there will be blood clot, and this would lead to death. Now here you have few terminologies: arteriosclerosis and atherosclerosis. There is a question, are these two terminologies similar or is there any difference? To understand this thing, we have to have a look on it. Like arteriosclerosis and atherosclerosis are different conditions. Arteriosclerosis is the stiffening or hardening of the arterial wall. Because of this condition, artery loses its elasticity and blood flow, blood supply, ultimately the oxygen supply to that part will not occur. Now atherosclerosis is the narrowing of the artery because of the plaque building up. So atherosclerosis is a specific type of arteriosclerosis. You will also come across with this word, that is thrombosis. Now thrombosis, when we say, it is the formation of a blood clot known as thrombus within a blood vessel. It's the same explanation. Here in atherosclerosis, fats deposits. When it starts to deposit, it will turn into cholesterol, that the layer of the thick fat and cholesterol which will build up in an arterial wall, forming plaque or erythroma. The plaque prevent heart muscles from getting blood supply and enough oxygen that is required to the heart muscle cells. Now, if you have atherosclerosis, physical exertion, emotional stress, it can bring on your chest pain, that is called angina. Because of this reduced blood flow, the rough edges of the plaque and the blood clot sometimes form. This can block the whole artery, or plaque may rupture. This also causes blood to clot. This is called erythrothrombosis. Thrombosis we have just discussed. As it is done in these arterial walls, it is called atherothrombosis. Now thrombosis stops an area of the heart muscle receiving blood and oxygen, leading to permanent damage. This is called myocardial infarction or heart attack. If a lot of your heart muscles is damaged, your heart may stop beating regularly or stop beating at all. So this would again lead to death. Now here we have to have a look on some causes of coronary heart disease. Atherosclerosis, which would lead to angina, and then there is heart attack. Now angina, which is a simple definition. Angina is a type of chest discomfort by poor blood flow through the blood vessels, that is coronary vessel of the heart muscles. We call it myocardium. Causes, it would be hereditary, diabetes, high blood pressure, abnormal cholesterol. You definitely know that is good cholesterol and bad cholesterol. HDL is actually a good cholesterol for the body, and LDL, that is also called bad cholesterol. Now move towards the next, that is smokers, chronic kidney disease, stroke, which is also the disease where blood is not getting enough of oxygen as blood flow is poor. Other risk factors like alcohol abuse, not getting enough exercise, and stress. What are the symptoms? Chest pain, that is angina, the discomfort when body is not getting enough oxygen, and the person is feeling heavy. Pain usually with any kind of activity, that is emotional stress is also there. Shortness of breath, fatigue. Here are some of the tests which are very helpful to diagnose. Usually doctors advise to take a decision, while some of the tests which are very helpful, we can say that is ECG, electrocardiogram, exercise stress test, echocardiogram, nuclear scan, electron beam computed tomography, CT angiography, magnetic resonance angiography, coronary angiography, etc. Now we move towards prevention. First of all, we have to avoid or reduce stress. Don't smoke. Eat well-balanced meal So what it would be that is low in fat or cholesterol, having you can say servings of fruits, vegetables in a meal. Get regular exercise. Normally a person must be having at least 30 minutes of exercise. But if you have diabetes or any other condition, so you have to increase this time. That is from 30 to 60, or it would be 90. But you should consult your doctor. Keep your blood pressure below 130 by 80 mm of Hg. Keep your cholesterol and blood sugar level under control. Avoid alcohols, and it is recommended no alcohols. Treatment. Once again, treatment also depends upon your doctor's advice, specifically your cardiologist. So some medicines which your cardiologist according to your condition prescribe would be aspirin, statins, beta blockers, ACE, which is called ACE inhibitors. Now surgeries. Surgeries would be angioplasty and coronary artery bypass graft. This is also called CABG. So first of all, angioplasty. When we say angioplasty, it's better to have a look on this part. Here, angioplasty, we have this catheter or the stent. Maybe you know these terminologies. When we are saying angioplasty, so one catheter is inserted into that clot area. So this balloon expands. As it expands, it opens the clot, then it's deflated and removed. Now when you are saying stent, it is in most cases it is put to keep the path open, right? Okay, moving back. So this is the whole detail mentioning about angioplasty. Now come to coronary artery bypass graft. Here, see, you can see that this clot is forming. So this clot, if it's in the lumen of the artery, here a bypass artery is inserted, which will prevent this clot, and blood can flow by crossing this clot from this side to the other part of the artery. Here, this bypass, doctors maybe use blood vessel from another part of the body to make a path around the clot. Thank you very much. I hope you like this presentation. If you have any question, you may revert back.